Your feet have been trying to tell you something for months, maybe longer. That tingling you feel when you sit too long. The burning at night that wakes you up. The heel that keeps cracking no matter how much cream you put on it. You have been explaining it away, blaming it on age, on shoes, on the cold. And I understand that completely. But I need you to hear this clearly. Your body may have been warning you about elevated blood sugar long before any blood test ever would. And your feet are where it speaks first. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will know exactly what to look for on your own feet tonight, and what to do if you find it. Let's begin with the problem nobody talks about clearly enough. Most people believe diabetes can only be caught by a laboratory blood test. You see your doctor, the results come back, and that is when you find out. But what I have seen confirmed in clinical practice over and over is that the body begins sending signals about elevated blood sugar long before any lab result would catch it. And the very first place those signals appear is the feet. The American Diabetes Association estimates that 1 in 5 people with diabetes do not know they have it. That is millions of individuals right now with a silent condition quietly damaging their nerves, their kidneys, their vision, and their feet, all while feeling essentially fine. The tragedy is not that these signs are invisible. It is that they are entirely visible and almost nobody knows what they are looking at. A study published in the journal Diabetes Care found that the neurological and vascular signs of elevated blood sugar appear in the lower extremities on average 18 months to 2 years before a formal diagnosis is made. 18 months of warning that goes unrecognized because patients and sometimes physicians are not looking for it in the right place. I want to walk you through the signs that matter most, starting with the ones that do the most quiet damage. The first sign is tingling, numbness, or that pins and needles sensation in the feet, particularly when it happens regularly without a clear reason. Almost every patient I have seen with this has explained it away. They crossed their legs, they sat in one position too long. And yes, that happens to everyone occasionally. But frequent recurring numbness in the feet without an obvious cause is one of the earliest indicators that blood sugar has been elevated for some time. When glucose stays high in the bloodstream, it begins damaging the outer protective layer of the peripheral nerves, the ones that run from your spine all the way down to your toes. Think of those nerves as electrical cables. Every cable has a protective coating that allows signals to travel cleanly. High blood sugar acts like a slow acid on that coating. The wire still functions for a while, but the signals become unreliable. That unreliability is the tingling you feel. The American Diabetes Association reports that peripheral neuropathy, which is the clinical name for this nerve damage, affects nearly 50% of people with diabetes and almost always begins in the feet. Tens of millions of people are experiencing this sensation right now and attributing it to something else entirely. I had a patient I will call Francois. He was 67 years old, retired, described himself as reasonably healthy. He came in for a routine checkup. Before we ran any blood work, I asked him about his feet. He told me they had been a little numb for a while and he assumed it was simply aging. He had 4 of the 9 signs I examined him for. His fasting blood glucose came back at 214. He had been diabetic for over 2 years without knowing it. The second sign is a burning sensation in the soles of the feet, most intense at night when there are no distractions and nothing to focus on except the heat radiating from inside your own feet. My patients describe it as standing on warm pavement, or like something is pressing heat up through the floor. This is not inflammation and it is not circulation in the conventional sense. The nerves in the feet have been damaged by excess glucose and they are now sending incorrect signals to the brain. The brain receives a heat message even though nothing hot is touching the skin. Think of it like a fire alarm with a faulty sensor. The alarm is sounding because the sensor is damaged, not because there is a fire. Research published in Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before formal diagnosis. 3 years of warning going unaddressed. The third sign is one that stops being uncomfortable and starts becoming genuinely dangerous. A small wound, a blister from a shoe, a minor cut, that simply does not heal. Most small wounds close within a few days. But when blood sugar has been chronically elevated, the tiny blood vessels throughout the feet narrow and stiffen. Oxygen, white blood cells, and the nutrients required for tissue repair cannot reach the wound efficiently. The wound remains open, vulnerable, and exposed. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations, with over 100,000 cases each year in the United States alone. And nearly all of them began as a small wound that was ignored or left untreated for too long. I had a patient I will call Marguerite. 73 years old, came to see me only because her daughter insisted. She had a blister from new shoes that had been open for nearly a month. She had been applying a simple plaster and waiting. When I examined her, the wound had early signs of infection. Her blood sugar, when we tested it that day, was significantly elevated. We caught it before it progressed. But another few weeks and the conversation would have been very different. The fourth sign is persistent swelling in the feet and ankles, particularly swelling that leaves a visible indentation when you press a finger into it. That is what clinicians call pitting edema, and it carries a specific meaning. Elevated blood sugar damages the kidneys over time. The kidneys regulate the body's fluid balance. When their function is compromised, excess fluid accumulates in the lowest part of the body under the pull of gravity. Your feet and ankles swell. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity swelling is frequently the first visible sign that kidney function is under stress. The fifth sign is one most patients overlook entirely because it requires you to look carefully at a part of your body you rarely examine closely. When circulation to the feet is significantly compromised by blood vessel damage from high blood sugar, the hair follicles on the lower legs and the tops of the feet gradually stop receiving the oxygen and nutrients they need to function. Over time, they stop producing hair entirely. Think of hair follicles as small plants in a garden. When the irrigation is blocked, they do not die immediately. They simply stop growing. That absence of growth is a visible marker of blood vessel damage that in many cases has been progressing for years without any other outward sign. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in patients with elevated blood sugar, and is a reliable indicator that physicians are specifically trained to examine during foot assessments. Before I give you the action steps, I need to say something clearly and without softening it. If you recognize any of these signs in yourself, do not begin treating them independently, adjusting your diet aggressively without guidance, or making any changes to existing medication based on what you hear in this video. These signs are reasons to seek medical evaluation promptly, not reasons to self-manage. See your physician. Tell them specifically what you have observed and when it began. That information matters enormously for how quickly and accurately they can assess you. Now, what does the evidence support as the most effective response to these early warning signs? The most powerful combination is early detection combined with 2 lifestyle changes that carry decades of evidence behind them. The first is daily walking. A 20 to 30-minute walk every single day is one of the most effective interventions available for improving insulin sensitivity, reducing blood glucose levels, and protecting nerve endings in the feet by maintaining circulation. A landmark analysis published in Diabetologia found that regular moderate-intensity walking reduces the risk of type 2 diabetes progression by over 30% in adults over 60. The second is meaningful dietary fiber. Fiber slows the absorption of glucose into the bloodstream after meals, which directly reduces the demand on the pancreas and helps maintain stable blood sugar over time. Vegetables, legumes, oats, and whole grains consumed consistently at every meal produce measurable improvements in fasting blood glucose over weeks to months. I want to tell you about a patient I will call Simone. She was 69 when she came to me after noticing persistent tingling in her feet and cracking at her heels that no moisturizer had touched in over a year. Her blood sugar was elevated but had not yet reached a diabetic threshold. We discussed walking and dietary changes. She committed to a 20-minute walk every morning and reduced refined carbohydrates significantly. At her 3-month review, her fasting glucose had dropped by 21 points. Her foot tingling had diminished noticeably. She told me it was the first time in 2 years her feet had felt close to normal. Here is exactly what to do with what you have just heard. Step 1. Tonight before you go to sleep, sit down and examine both feet carefully. Look at the skin color, look between every toe, look at the tops of your feet and lower legs, note whether hair is present or significantly thinned, and check for any wound, blister, or crack that has not resolved on its own. Step 2. If you notice any of the 5 signs discussed in this video, call your physician tomorrow and request a fasting blood glucose test. It is inexpensive and widely available. Ask specifically about peripheral neuropathy evaluation if you are experiencing tingling or burning. Step 3. Begin a daily walk this week. Start with 10 minutes if 30 feels like too much. The critical thing is consistency, not distance. Step 4. At your next appointment, ask your physician directly whether your current blood glucose level has been formally evaluated within the past 12 months, and whether a hemoglobin A1C test has been performed. That test gives a 3-month average of blood sugar and is far more informative than a single fasting reading. Step 5. Add fiber to every main meal starting today. Not a dramatic dietary overhaul. Simply ensure that vegetables or legumes are present at every meal alongside whatever else you eat. One important clarification before we close. The signs discussed today are potential early indicators of elevated blood sugar, not a diagnosis. Tingling, burning, slow wound healing, swelling, and changes in skin or hair on the feet can also have other explanations, including circulatory conditions, thyroid issues, vitamin deficiencies, and medication side effects. Only a physician with your full medical history can determine the cause. Do not interpret any of these signs as confirmation of diabetes without a proper clinical evaluation. If you have already been diagnosed with diabetes and are actively managed by a physician, continue following their guidance and bring any new foot symptoms to their attention at your next appointment rather than waiting for a scheduled review. Your feet have been carrying you your entire life without complaint. They deserve 30 seconds of your attention tonight. Look at them. Know what you are looking for. And if something does not look right, make the call tomorrow. If this video gave you something to think about, hit the like button right now, leave a comment telling me whether you recognized any of these 5 signs in yourself or someone you love, and share this with a family member or friend who has never connected these everyday sensations to blood sugar. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.